My name is Professor Hopewell Ntsinjana. I'm the head of pediatric cardiology and the chair of academic and research committee here at the Nelson Mandela Children's Hospital. Pediatric cardiology is a pediatric specialty that deals with children with heart conditions. The biggest part of these conditions are the congenital heart defects, and these are the defects that children are born with. So these occur in utero, and the child is born with a heart defect. The current state of pediatric cardiac care in South Africa is in very distress at the moment. And that is mainly due to a number of factors which are very diverse. These range from the lack or the fewer number of specialists that deal with this specialty. And also the other problem is access to care, especially for the children who are born in the most remote areas of the country. So the shortage of trained pediatric cardiologists and cardiac surgeons or specialists in this field in general has a significant impact into the care of children with heart conditions, especially those that are from the impoverished conditions. There is an ongoing battle to try and address the backlog of these patients. We diagnose our patients very late, as compared to the first world where there is prenatal diagnosis, such that even before a child is born, the diagnosis is known, which leads into early intervention. They will attend antenatal clinic, but there are no trained specialists to look at their hearts. They just look at the heartbeat, but nobody looks at the structure of the heart itself. Which means these children, instead of being born at a tertiary or quaternary center where the child can be cared for, these children can be born at a primary health care clinic, and some of them, depending on whether they have a critical or non-critical congenital heart defect, will be sent home sometimes and they collapse at home, and only then they are evacuated and sent into a center that has some form of idea on how to care for these children. Investing in their training does not only invest in the individuals, but also invest in the outcomes and the care of the children with these congenital heart defects. As things stand in South Africa, about 11,000 of these children will be born every year with a congenital heart defect, but only about around 25% to 30% of them, especially in the public sector, will be able to access a quaternary tertiary center that is going to care for them. And there is research done which is very relevant to our African settings. It is about time where we do our own research so that we can look at the problems that face our own children